Have you ever heard of the saying, "People say I look so happy," and I say, "That's the Botox"? Welcome to the Fact Check channel. If you haven't subscribed, please do. Before we can check deeper into the cosmetics anti-aging darling of the industry, we need to understand what Botox is. Botox is a drug prepared from botulin, used medically to treat certain muscular conditions and cosmetically to remove wrinkles, by temporarily paralyzing facial muscles. But how exactly does Botox work? Botox shots block certain chemical signals from nerves that cause muscles to contract. The most common use of these injections is to relax the facial muscles that cause frown lines and other facial wrinkles. Botox originated with the German doctor, Justinus Kerner, in 1920. Dr. Kerner was studying the causes of undetermined deaths in the area, and when he discovered the botulinum toxin, he noted that the toxin also caused muscle weakness. Botox is the brand name of the neurotoxin botulinum toxin produced by Allergan Pharmaceuticals, though we tend to refer to all treatments with a muscle relaxant as Botox treatment, just as we might refer to vacuuming as hoovering, even if we do not use a Hoover brand. When someone says they get Botox, they may not mean exactly what you think. Indeed, there are 4 related injectables on the market. 1. Botox, 2. Dysport, 3. Jeuveau, 4. Xeomin. At this point most people have heard of Botox, but did you know that this is just one of many different types of Botox brands we call neuromodulators or neurotoxins? Neuromodulators are the umbrella term for any product that utilizes botulinum toxin to temporarily relax a target muscle in order to prevent and sometimes treat fine lines and wrinkles. Botox has come to be the household name for neuromodulators. What is the difference in these brands? 1. Formulation. The biggest difference between brands is the form of botulinum toxin that is used. Botox is made of onabotulinum toxin A, Dysport is abobotulinum toxin A, Jeuveau is another form of botulinum toxin type A, and Xeomin is incobotulinum toxin A. At the end of the day, all of these forms are effective in relaxing muscular contraction, so all will help to reduce the appearance of fine lines and wrinkles. However, there are some slight nuances that arise due to the different formulations. 2. Onset and duration. According to the International Association for Physicians in Aesthetic Medicine, IAPAM, the average onset of Dysport is 3 hours, Botox is 72 hours, and Xeomin is 96 hours. In practice, most people notice the results of Dysport and Jeuveau within 3 to 7 days post-injection, while Botox and Xeomin are typically noticeable after 1 to 2 weeks. For all products, dose equals duration, meaning that the higher the dosage used, the longer the results can be expected to last, within reason. The average duration for most people is between 2 to 5 months. 3. Resistance. While rare, some people may develop a tolerance or resistance to neurotoxins due to the creation of antibodies. A person's immune system may identify the ingredients used in these injections as being a foreign invader, so it responds by producing antibodies that neutralize their effect. While resistance can occur with any of these 4 types of injections, it's most common with Botox and Dysport. Botox and Dysport contain additives that can irritate the immune system and, thus, trigger the creation of antibodies. Xeomin, on the other hand, consists solely of botulinum toxin, so it's less likely to cause resistance than its counterparts. However, there still have been reported cases of tolerance to Xeomin. This has led researchers to believe that it might be the actual botulinum toxin causing antibody formation instead of, or possibly in addition to the additives. However, the jury is still out on that. All in all, only about 1 in 100 people who receive a neurotox injection will develop a resistance to it. 4. Dosage and pricing. Dosage will vary from person to person. However, you can typically expect that you will need 2 to 3 times the number of units of Dysport as you would with Botox, Xeomin, and Jeuveau. Botox is usually the most expensive per unit as you are paying for the brand, and Jeuveau is usually the most cost-effective. Evolus, the company that produces Jeuveau, was able to achieve a lower price by focusing its FDA approval specifically on cosmetic applications for its product, whereas Botox is approved for both medical and cosmetic purposes. At the end of the day, all 4 products are FDA approved and all work well to help reduce and prevent fine lines and wrinkles. Come in for a consult today to help decide which brand could be the right fit for you. Are Botox safe? Botox injections are usually safe when you're under the care of a licensed and skilled healthcare provider. The procedure can result in unwanted results or even cause harm if it's given incorrectly. Possible side effects and unwanted results include pain, swelling or bruising at the injection site, headache or flu-like symptoms, droopy eyelids or crooked eyebrows, a crooked smile or drooling, watery or dry eyes, infection at the injection site. Let us now look at the Botox administration process. Before taking Botox injections, it's always good to remember that Botox is a prescription medicine and must be used only under the care of a licensed and skilled healthcare provider. Talk with your healthcare provider about whether the procedure fits your needs. Find an expert in Botox injections. Ask for a referral from your primary care provider. Botox injections are usually performed in a medical office. Your healthcare provider uses a thin needle to inject tiny amounts of botulinum toxin into your skin or muscles. The number of shots needed depends on the size of the treatment area and other things. Sometimes ultrasound is used to guide the needle to the right spot. How you prepare. Which type of botulinum injection is right for you depends on your needs and condition. Talk with your healthcare provider about the treatment best suited to you. Tell your healthcare provider if you've had any type of Botox injection within the past 4 months. Also tell your healthcare provider if you take blood thinners. You may need to stop taking them several days before your injection to reduce the risk of bleeding or bruising. Talk with the healthcare provider who prescribes these medicines as soon as you can. What you can expect before the procedure. Most people don't feel much pain during the procedure. But you may want your skin numbed beforehand, especially if your palms or feet are being treated for heavy sweating. Your healthcare provider might use one or more of the following methods to numb the area: anesthetic applied to the skin, ice and massage. The massage method also is called vibration anesthesia. After the procedure, do not rub or massage the treated areas for 24 hours. And don't lie down for 2 to 4 hours after getting the shots. Following this advice helps prevent the toxin from spreading to an area where it isn't needed. You'll likely be able to return to your usual activities right after the procedure. Check with your healthcare provider. Results. Botox injections usually begin working 1 to 3 days after treatment, though it can take a week or more to see full results. Not all people have visible results or relief from symptoms. Depending on the problem being treated, the effect may last 3 to 4 months. To maintain the effect, you'll likely need regular follow-up injections spaced at least 3 months apart. As a rule, healthcare providers don't recommend Botox if you're pregnant or breastfeeding. Rarely, the medicine may spread to parts of the body where it isn't supposed to go. It can cause symptoms there. Call your healthcare provider right away if you have any of these symptoms hours or weeks after your procedure: muscle weakness, vision problems, trouble talking or swallowing, breathing problems, allergic reaction, loss of bladder control. It's also important to note that Botox injections also are used to ease symptoms of some health conditions. It's not a cure. Examples of medical conditions that might be treated with Botox injections include: 1. Neck spasms. In this painful condition, the neck muscles contract in an uncontrolled way. This causes the head to twist or turn into an uncomfortable position. The condition also is called cervical dystonia. 2. Other muscle spasms. Cerebral palsy and other conditions of the nervous system can cause the limbs to pull in toward the center of the body. Muscle spasms also can cause eye twitching. 3. Lazy eye. The most common cause of lazy eye is an imbalance in the muscles used for moving the eye. Lazy eye also is called crossed eyes or misaligned eyes. Sweating. Botox might be used for a condition in which people sweat a lot even when they're not hot or working up a sweat. It's called excessive sweating or hyperhidrosis. 5. Migraine. Botox injections may help reduce how often you get a migraine. This treatment is used mainly for people who have headaches 15 or more days a month. When you get serious headaches that often, the condition is called chronic migraine. Treatment is needed about every 3 months to retain the benefit. 6. Bladder problems. Botox shots can also help reduce urinary incontinence caused by an overactive bladder. 10 things you should know before getting Botox treatment. Consultation is important. Before getting Botox, a Botox clinic should offer a consultation. 1. The different costs. Before getting Botox, a Botox clinic should offer a consultation. A professional will ask you to smile, frown and raise your eyebrows. These expressions show them how your face naturally moves so they can place injections correctly. 2. The different costs. Botox is either charged by the unit or by the treatment area. The cost may also vary depending on the quality of the Botox used, whether it's being administered by a dermatologist as well as where the practice is located. Big cities tend to be more expensive and board-certified injectors charge more for their services. 3. Possible side effects. Price shouldn't be your number one concern while looking for Botox treatment. Finding a reputable practitioner is more important. That's because there are complications that can arise from Botox if it's not injected correctly. Swelling and headaches are considered normal side effects, but there are others that have a longer-lasting impact. If Botox isn't injected correctly, it can unintentionally spread to muscles in your face and cause sagging or drooping in your eyelid. 4. Bruising is normal. Botox is injected just below the skin's surface with a fine needle, meaning it usually doesn't result in bruising in the same way as fillers. Sometimes, the needle hits a blood vessel and causes bruising. These usually fade on their own in a matter of days. Some providers offer next-day treatment for bruises. They'll break down the bruise with a laser treatment and your bruise will be gone within 24 hours. You're more likely to experience mild redness and swelling than a bruise. Typically this is gone within a few hours of your injection and you can go right back to your daily activities, with a few exceptions. 5. Aftercare is key. What are the exceptions to returning to your daily routine? The neurotoxin injected into your muscles needs time to settle. That requires that you don't put makeup on the area and avoid touching your face, lying down and exercise. Any of these activities could cause the toxin to spread to unintended areas and weaken its effects. Don't even fly for a few days after your Botox. The pressure can negatively affect the toxins and how they move under the surface of your skin. 5. Botox doesn't last forever. Unlike surgical procedures, Botox injections are not permanent. You'll notice the results within 3 days, but it can take up to 2 weeks for the full effect to kick in. How long it lasts is different for everyone. Most injections last between 3 and 6 months, with the average being 4. It also depends on what areas were injected and how many units were used. The quality of the Botox is also important. If you had any complications, Botox isn't reversible. You have to wait until the neurotoxin wears off before those adverse reactions go away. 6. Botox is a preventative treatment. By the time you reach your early 20s or late 30s, you might already be noticing expression lines. Some of these are only visible when you move your face and others might be starting to look more permanent. Botox relaxes your muscles. The more relaxed those muscles are, the less they are moving around, creating expression lines and wrinkles. That's how Botox injections can prevent lines and wrinkles from getting worse. But that also means that you'll have to keep using it for the desired result. 7. More than just wrinkles. As more research is conducted, more uses for Botox are being found. Besides making your face look more youthful, Botox has been shown to have a positive impact on muscle spasm, migraines, depression and even sweating. Some of these treatments are still in early research stages, so you should talk to your professional about whether you're a candidate. 8. Decide if you want filler. Filler can be used to contour and volume to your face and lips. These injections are placed beneath the skin's surface to literally fill in lines and wrinkles and revitalize your skin. Filler is often used in combination with Botox injections because it covers areas that Botox doesn't. Tear trough filler. Cheek fillers, nose fillers, under-eye fillers and chin filler can make your Botox look even better. Other than collagen, filler lasts between 6 and 18 months, so you get longer wear than you do with Botox. 9. Consider getting Botox with a thread lift. Along with fillers, thread lifts are also commonly combined with Botox to achieve great results. Thread lifts are known as non-surgical facelifts. Without any incisions, threads made from polydioxanone, PDO, are injected beneath the skin to give a lifting effect. This minimally invasive procedure works with Botox to smooth wrinkles, raise sagging skin and tighten your brow line. 10. More on facial rejuvenation. The visible signs of aging can affect your self-confidence. With minimally invasive procedures like Botox, you can restore your youthful glow and take that power back. But Botox isn't the only method for minimizing wrinkles, contouring your face and bringing volume back to skin that's sagging. Other facial aesthetics like fillers and thread lifts can take years off your face. Use them on their own or combine them with Botox injections to achieve amazing, restorative results that will last anywhere from 3 to 18 months. It's also important to note that Botox is a neurotoxin. These substances target the nervous system, disrupting the nerve signaling processes that stimulate muscle contraction. This is how the drug causes temporary muscle paralysis. In order for any muscle to contract, the nerves release a chemical messenger called acetylcholine at the junction where nerve endings meet muscle cells. Acetylcholine attaches to receptors on the muscle cells and causes the cells to contract, or shorten. Botox injections prevent the release of acetylcholine, which stops the muscle cells from contracting. In this way, the toxin helps the muscles to become less stiff, therefore whether for cosmetic or medical use, make sure that the procedure is necessary. In conclusion, remember, as it turns out, for most patients, Botox is more preventative than restorative. Its active ingredient freezes facial muscles to keep you from contracting them in ways that deepen lines and wrinkles. Any line that is present at rest, whether it is an etched-in frown line, or a deep wrinkle, is not going to disappear with Botox.